Carpal tunnel syndrome sounds like a very complicated thing, but it's actually pretty simple to understand. It's a problem where a major nerve in your wrist is basically being pinched. It doesn't quite have enough room. In carpal tunnel, there's a nerve called the median nerve, and it basically runs right where my finger is. And it's traveling down through the forearm, and it's coursing through the wrist to get to the fingers. And when it passes right through the wrist, this zone right here, that's the carpal canal or carpal tunnel. And between my thumb and my index finger, the nerve has to share a very tiny space. And crammed into that space are 9 tendons that move your fingers and this one very sensitive nerve. The earliest symptom someone will feel with carpal tunnel is a symptom that they typically ignore and they don't even attribute to something wrong with their hands. It's a symptom where they wake up in the middle of the night with tingly, numb fingers. When the fingers tingle, it's classically just certain fingers. It's the thumb, the index finger, the middle finger, and potentially just a little bit of the ring finger. Those are the fingers supplied by the median nerve. Carpal tunnel syndrome is very, very common. It tends to be something that will affect people that are in their 30s, 40s, and 50s. 30s is even a little bit young. It's more of a middle-aged problem, 40s and 50s. For reasons that we don't understand, it affects women far more than men. We think that has something to do with hormones, but we're not sure. It's a problem that can be aggravated by anything that you do that's highly repetitious. So if you are waking up at night with numb, tingly fingers and it quickly goes away with you just moving your wrist into a different position, the first thing a doctor is going to do when you go see them, so you could certainly do this on your own, is go to your local pharmacy and ask for a carpal tunnel brace. It's a simple little brace. It's applied to the wrist and it has Velcro straps across the back, and it has a little piece of metal built in that keeps the wrist perfectly straight. And that wrist brace will keep the wrist positioned in a way that the nerve has the most amount of room while you're sleeping at night, and you won't tend to curl your wrist like most people do when they sleep, and therefore you won't pinch your nerve while you're sleeping, and that can stop early symptoms of carpal tunnel syndrome. Now, certainly you can pick up a brace and try it, and it's a nighttime only brace, and if that quickly, within a week or so, stops your symptoms, you probably don't need to go see anybody at that point in time. But if for some reason your fingers still get numb and tingly at night while sleeping, even though you're wearing a brace, or more importantly, if you start to get episodes during the daytime when your fingers will go numb, reading a book, driving a car, or just sitting quietly, you would want to see a doctor at that time. Treatment really depends on where you are in the stage of carpal tunnel when you finally come to a doctor. If it's very early on and you have no other major problems contributing to why you have carpal tunnel, for instance, diabetes or endocrine problems, hormonal problems, thyroid disorders, things that need to be, you may need to have additional blood work or medication adjustments to get those under control to make your carpal tunnel go away. But if you don't have any of those things and you only have carpal tunnel syndrome, if your symptoms are of short duration, a couple months, we're definitely going to go with night bracing, and then we may add in some stretching and strengthening exercises, either taught by us or taught by a therapist. Now, if some of these things that we try first, what a doctor would call conservative treatment, or probably more appropriately non-operative treatment, if those things aren't bringing your symptoms under control, and we'll give it 6 or 8 weeks sometimes to let things kind of work themselves out, but if your symptoms aren't coming under control with non-operative treatment, there is surgery that does very well, very predictably for carpal tunnel.